Hello, and how are you? Welcome to my session on Kenya Hospice and Palliative Care Association. My name is Winnie Barao. If you're new here, kindly remember to subscribe and click on the notification button. Just to remind us, this is a platform where we do lectures, notes, and expert interviews relating to healthcare. If this is an area that really intrigues you, kindly remember to subscribe and follow us or watch through the other videos in the platform. So let's get through and discuss what Kenya Hospice and Palliative Care Association does in Kenya. If you're in Kenya, maybe you've heard about them or you've seen through your website. So most of the knowledge you'll be sharing here is actually generated from their guidelines and also what they do in the society. So let's dwell together and see what they do. So by introduction, the Kenya Palliative Care Association, this is an association that represents all the palliative care providers in Kenya, ensuring that no one with a life-threatening illness dies or lives with unnecessary pain and distress. So what this association does, it advocates for integration of palliative care into the public healthcare system and in the universal health coverage package. It ensures that it advises the government, it advises the Ministry of Health and any other relevant stakeholders pertaining to guidelines and care as per patients who have terminal illnesses or diseases. So it's an association that is well registered, active, and works together with ministries and consultancies to guide through in helping integrate palliative care in the public health system. So the major functions is what we are going to focus on today. And one of the main functions of Kehpca is actually to do capacity building. Now, with capacity building, we mean that the association believes in having informed and empowered workforce who are being direct providers of this care through training and capacity building services. So what the association does is it provides support. It also do development or guideline development. It enhances skills, provide coaching, and also it does teaching and knowledge transfer to the officers or the people on the ground who are practicing palliative care. So it offers CMEs or continuous development. It also offers trainings and it does guiding and consultancies to associations or even ministry that require their inputs. The second function of the association is to participate in research, information, and technology. Now, appreciating that research is very essential, especially if you're looking into progress and development in the area of palliative care services. So most of the time, the association focuses more on strengthening healthcare systems by helping integration of these palliative care services. Remember, one of the challenges that we mentioned when we are looking at the team of palliative care is that most of the people have not embraced specialization in palliative care and the number of specialists is so low. So for this purpose, they need to encourage more people to embrace training in palliative care. Also, there's aspect of bringing in the curriculum to embrace or to be embraced in the training within medical schools and colleges. So they also look into addressing palliative care needs, like there's research into the areas of needs around palliative care or best practices that can be enhanced to enable positive outcomes among palliative care services. And also there's evidence translation, where we can translate evidence into practice or translating research into practice. So this is a very broad area. It can be implemented in more diverse and innovative ways, but the main role is to incorporate research, information, and technology, or rather what we call IT. And the other bit is health system and strengthening. Health systems is what runs all the services anywhere simply. But in health, we talk about major ministries and organizations that are at the forefront in promoting or encouraging proper practice of service. For example, we have the WHO or the World Health Organization. This model is the one that supports integration of palliative care into the existing healthcare system. So the system or the World Health Organization support system, what it does, it focuses more on 4 key elements that are very important for palliative care. And here we talk about policy, education, access to essential services, and implementation. So the model provides key elements that you can put in place in case you are forging for proper policies that encourage practice of palliative care. The model also looks into education, where there's integration of palliative care in the curriculum, just like what we are doing now. And then there's access to essential services, that patients can all access palliative care services in all the facilities and with all the essential drugs that are needful. And of course, we have implementation model, like where you can have the access of these palliative services at all levels, not just at the national level, but you can have them even at the county levels, community levels, and everyone can either access information or can access treatment, and also they should be able to access consultations and so on. So how do they work? To help in health system strengthening, they work with the Ministry of Health and the government, that is through advisory route or technical key inputs that will help the system to integrate these palliative care services into the healthcare system, into the healthcare facilities, and to generally make the ministry aware of what should be the best practice when it comes to palliative care implementations. So under health strengthening, these are a few areas that the Kehpca can work together to support. So we have the health system, which is made of health service delivery. We have aspects of leadership and governance, and then we also have resources. So leadership and governance, they work around together with the service delivery, that is how the service is given. And then on resources, we're looking at infrastructures and supplies. Do we have the knowledge and the information? Do we have the funding and finances? And then what is the nature of human resources that we have that can be part and parcel of our health system? And in all this, remember what we are impacting on is the population of the people, and these are the users of the palliative care services. So with this in place, we're just looking into how can palliative care be efficiently be implemented that the population benefits from it maximally. And the fourth function is looking into integration of cancer treatment and palliation. This is working together or towards improving access to population-based primary prevention, early detection, and quality diagnostic, treatment, and palliative care services. Now, need to put in mind that cancer is one of the leading cause of palliative care, or is one of the leading disease that is under palliative care, because it's a very demanding condition or a disease. It's one of the diseases that still has poor prognosis, and you realize that most clients with cancer diagnosis, the progress is not that positive, and so majority ends up prescribed for palliative care as one of the supportive approaches. So therefore, it's a very key component for cancer care, and it is very beneficial that the healthcare system institutes or put in place good diagnostic quality management, treatment, and even proper palliative care, catering for both pediatrics and the adults. And the other special arena is the issue of geriatrics or the elderly care. So the case of this needs to be as broad as possible, covering all aspects of the population, from the children to the adults and even the aged. So basically, Kehpca is advocating for better access to oncology services in line with the universal health coverage guidelines, or in line with the universal health. And the fifth function that Kehpca does is communication, community engagement, and cultural transformation. So there's in the challenges, we also mentioned that there's a gap when it comes to information access to our patient and the community, that most of them, they don't understand what palliative care entails. And so when you prescribe palliative care to them, majority of them, they lose hope and they think you're dooming them to death, or you don't believe that they can get well. So to break this myth and to break these misconceptions, it's therefore important that Kehpca carries on with the community engagement, to do dialogues, do forums and health education, to just sensitize community members to appreciate how palliative care is done, to appreciate the development that have been in place. So service providers and caregivers generally who work in the hospice and palliative care unit spend time with the community and address all the worries and issues that are not clearly understood, or they are major component of decision making when it comes to uptaking of palliative care services. And so these are different ways of how these are proper effective communication, community engagement, and culture transformation. So you can have just using materials that are in plain language and members can easily read and understand. And then we can have either information sharing through maybe media or TV and all those methods. Is issues on transparently giving information to the public, creating public dialogues, attitude and behavior change, being there to listen when they have these questions and not just shushing them off. You can build networks and relationships, create partnership, and you can explain all this, what it is about palliative care, call for people who can invest in palliative care. This is a way of communicating and engaging to cause transformation around palliative care. And lastly, the other role is Kehpca is to provide organization growth and sustainability. So it is the role of Kehpca to just work around resource availability to just allow um, progress of this association so that you can have robust leadership, work with other partners, both local and international, to bring on board more resources that can help us scale up the existing and any upcoming palliative care services. Because at the end of the day, this is the vehicle that propagates the growth of palliative care in our country, Kenya. So therefore, there's a big role that they need to have, either have a sustainability plan or have a strategic plan that looks into place the long-term impact or the long-term journey that Kehpca can have in terms of growth and sustainability of the association in promoting palliative care in the country. And so that's it on the role of Kenya Palliative Care Association, whereby it focuses more on people who practice palliative care and it works around helping them with research, community engagement, and it also looks together with the government in terms of healthcare system strengthening and ensuring that there is enough development in even incorporation of information technology in the arena of healthcare and palliative care. Thank you so much for being with me. If you've not yet subscribed, please do so. And also you can give a comment if it was clear or you wish me to elaborate more on other areas, or if you just have a general question that you wish to ask. Until then, see you in our next class. Bye bye.